Hey, it's Dominique from Well Medical Arts, and I'm getting to show you what thread lifting can do for lifting, or what we call repositioning, of the mid-face. Wonderful tool. So we've gone in and we've already revolumized through her cheeks. Her cheeks look so beautiful, but it didn't give us as much lift as we want through right here. Now, honestly, in the future, we started her cheeks with the radius, nice filler for her, looks so good. But when the radius runs out, we're gonna be putting it in with a longer lasting Bellafill, and we're also gonna be getting her temples to lift, the brow, the cheek, more with the Bellafill. That will be a more longer lasting solution. But right now, she's got the radius in, and we still want a little bit of lift through here. So we're gonna go ahead and get the threads to lift this lower face. I've gone in and arnica'd, cleansed, and numbed, and now I will show you the threads. These threads are made out of PDO, which is dissolvable suture material. It's actually a glucose, a sugar complex. There are many different sizes of threads, widths of threads, lengths of threads, shapes of threads that you can use for different things. This one in particular right here is what's called a molded thread. It's a strong thread in its shape. There we go. So I'm gonna go in, good job. I'm getting it attached. I'm getting this nasolabial fold to lift, and then the thread is out, and look at that lift. Yay! And then I'm gonna go in. And you can see on the thread all of the little kind of teeth, the cogs that are in it, that grab onto the skin and help lift and reposition the skin. Good job. So most of this should be pretty numb. This area right down here, you might feel a little bit. Hang in there, babe. I'm going into that unnumbed area. Breathe. Breathe. And you made it. Good job.
Yeah, that's not bad.
Not too bad. Yep.
Oh, it didn't really hurt.
Great. And then the next one. So they really are pretty easy for what you get. Look at how much that's lifting through there. Her before and afters are gonna look spectacular. Same thing, more down towards the jaw. Awesome. Same thing, breathe, breathe, breathe. You're doing great. Yep. Get this thread to attach, and you've made it. It's out. Yay. So even that area that we can't get all the way numb down there, it's not in there for very long.
No, it was really fast.
0 to 10. 0 is none and 10's the worst in your life. How much did that hurt? Tell them the truth.
Like 1, barely 1.
1, barely 1. Great. So we numbed her up pretty good, and the area that wasn't entirely numb wasn't too bad and wasn't in there long. Now, I do want to show you, I'm going to grab the mirror and let's compare your right to your left. So go ahead and take a look.
Oh my gosh, yay.
Isn't that great?
Oh my gosh.
So can you zoom in there and take a look? Look at how much better this nasolabial and this marionette is compared to this side.
So much better.
And actually, you're leaning back, so you look really good right now, but when we sit you up, you'll really see the difference in how much more this side is lifted than that side.
Oh my gosh. I can tell.
Yeah, it looks good, doesn't
And
it?
I'm so glad it didn't hurt.
Yeah. Okay, so we pull back to give a little bit of traction. I like these L-tips. They slide in nice and easy. And your right subdermal, so when you're in that right plane, it should feel like a nice, easy glide. Great, attach it, and you're out. Wonderful. How was that one, okay?
Yes. Kind of feels good when you pull it out.
It does. I know
Like,
exactly. I know
kind of
exactly
a
what you
weird
mean.
sensation.
Like a little bit of a relief.
Yeah.
Yes. There we go. Same thing. Straight down. Hang in there, Mama. You're just going into that area that's a little tender. Just about got it. Attach that thread, and you made it. Yeah. Feels good to pull it out.
Yes.
Mm-hmm. Nice. Incredible. Good job, good job. Get it down into that gel area where we want it. Hang in there, babe. That's it. And it's attached. And you made it. It's like, woo, get it out, right?
Yeah.
It gives such a nice result for that little tiny bit. Now, as I am attaching these towards the top, you might be able to hear it. It's kind of funny. Sometimes you can hear this little click, click, click as it's attaching. Hear that?
Yeah.
Yeah. And as you're massaging, when you're washing your face and rubbing your moisturizer, and I want you to rub in the upward direction, you might hear that little bit of clicking. It's not a big deal.
Okay.
So I'm going to go ahead and cut these down. It's very, very easy. You shouldn't feel anything. Great. Same thing. Great. Super good. And let's get the other side. All right, so we finished. It looks amazing. And now I put a little topical arnica on there to help it heal. Put a little warm compress, which just feels so great. And let you know, very normal to have swelling at the injection sites right there. I put more lidocaine on this side because this was her tender site, so she's more swollen. Normal to have just a little bit of insertion site swelling. That's normal. That'll go down. Take your oral arnica. Use your warm compress like this. Put a wet washcloth in the microwave for like 25-30 seconds and do the warm compress if it's a little tender tomorrow. I always tell people I'm surprised that it really usually doesn't bruise, but swelling is normal and it's a little bit more tender than I would thought. Now what's going to happen is you're going to feel like you don't want to make any big facial movements. Like tonight, you're going to want to eat something, but you only open your mouth a little bit. You don't want to be chewing on steak or opening your mouth for a big. So you try to open your mouth and you'll be like, oh yeah, I can feel that. I don't want to stress that. So try to suppress a yawn. Try to no big facial movements. And then when you wash your face, you're going to wash in that upward direction. And don't worry if you do hear a little bit of that thread clicking. That's normal. And then these should last about 6 months. And your body's going to start building collagen in about 3 weeks. So everywhere where we put them, it's going to build that collagen.
Nice.
Yay.
I'm so excited.
Do you have any questions?
No, I am so glad that it was not painful at all.
Oh, good.
You know, I was a little scared, but
Yeah.
I didn't feel really anything.
Because it looks it, when you're watching it, you're like, ooh, oh my gosh.
Yeah.
And I tell people, don't watch it because it does look scary, but it's actually easy. For what you get,
so much
it's
easier.
really easy. And look
so
at how
much
great you
easier.
look.
You're great. Oh my God, I'm so happy.
I'm happy
I
for
knew
you.
I would love this.
And you're so beautiful. I'm glad you're taking care of yourself.
Thank you. I can't
Good job.
wait to do the Bella film next.
I know.
Thank you so much.
You're welcome.